Hello, today I will give you some tips on vaccinations. This means the answers to frequently asked questions, the questions by the parents, the health workers, medical students, nursing staffs, and during exams even by the teachers. These questions are asked. So this is important for the students as well as the clinical practitioners. So number one question, child has upper respiratory infections and mild fever which can be less than 38.5 degrees Celsius. Can the vaccine be given in this condition? So the answer should be yes. You should continue the vaccination. This is not a contraindication. If child has diarrhea, what to do? So in this condition, non-oral vaccines you continue. It can be given. In case of oral vaccines, if the diarrhea is mild, otherwise the child is well, then oral vaccines can be given. But if the diarrhea is moderate to severe with vomiting, then the oral vaccines are deferred, not contraindicated. So defer until the child recovers, because in diarrhea, if there is a severe diarrhea, this can reduce the absorption, so makes the vaccine less effective. And vomiting, child may spit out the vaccine dose, so it will be also ineffective. So just defer. Another question, static neurological diseases such as cerebral palsy, Down syndrome, in these conditions, can the child be vaccinated? So answer should be yes. All the routine vaccines should be given in time like to the other children. But suppose in these children, if there is an uncontrolled seizure, if there is a serious intercurrent illness, then there should be temporary delay in vaccinating the child. So after the child improves, you can continue all the vaccines. What if the dose is missed? So suppose a child misses the dose, then answer is you will continue from where it was left off. Give the missed doses as soon as possible. There is no need to restart the schedule. Suppose a child has got BCG at birth and pentavalent first dose at 6 weeks. Then the child misses the dose, comes after 2 or 3 months. Then you continue with the second dose of pentavalent, then third dose of pentavalent. So accordingly, whatever the schedule is mentioning, you continue that way. You don't have to restart the schedule. Suppose the child is 9-month-old and the child is not vaccinated, what to do? So in this case, start with the same sequence of immunization. If the missed dose gap is too long, more than 1 year, then what to do? Suppose the child gets first dose of pentavalent vaccine, then the child comes after 1 year, then what to do? So in this condition, vaccination should still be continued. You never restart the vaccination because the earlier doses remain valid. So even the child comes after 1 year, then you continue with the same schedule of vaccination. Give next dose, whichever is due, immediately. Suppose example, here I have given one example. Child received pentavalent dose first, then the child missed second and third doses. The child comes after 1 year, then you give the pentavalent vaccine immediately, and then after 4 weeks give the third dose. So similarly, whatever is scheduled with those vaccines, you can continue. Live vaccines are contraindicated in which conditions? Answer should be live vaccines, both oral and injectable, is contraindicated in severe cell-mediated immunodeficiency conditions. So those can be severe combined immunodeficiency disorder, advanced symptomatic HIV, post-transplant condition, high-dose chemotherapy or steroids, whoever is receiving these drugs, and during pregnancy. Child suffers from severe malnutrition. So which vaccines to give? Because here also child is immunodeficient. But the answer is give all the routine vaccines. Postpone only if child is very acutely ill. Because in severe malnutrition, cell-mediated immunity is impaired, it is not absent. So vaccine strains do not cause disseminated disease, so you give all vaccines. But you avoid if the malnutrition is associated with the conditions like HIV or severe combined immunodeficiency disorders. If the malnutrition is alone, then you can give all vaccines. BCG is exception. BCG is not given in severe malnutrition because BCG is a live bacterial vaccine which replicates intracellularly. And for BCG, immune response is strongly dependent on the intact T cell immunity, which is impaired in severe malnutrition. So there is increased risk of disseminated tuberculosis if you give BCG. So BCG is not given in severe malnutrition. You wait for the child to recover. So after the recovery, you can give. If child has dermatosis, eczema or localized skin infection, what to do? So in this condition also, all vaccine schedules can be given. There is no contraindication. Should the child be vaccinated if child already had the disease? The answer is yes, you should vaccinate because the infection may not give the lifelong immunity. And if you give vaccines, that is going to boost the immunity and standardize the immunity. So vaccinate if the child has disease like measles, pertussis, diphtheria, polio, typhoid. You have to give the vaccines even if the child got the disease. But exception is some natural disease where you get a reliable lifelong immunity. Like BCG, if it is a proven condition, then no need to give BCG. Similarly, varicella and hepatitis A, if it is confirmed cases, then no need to give vaccination. Okay, vaccinated child can still get the disease. This is the question asked by many people. So the answer is yes, because vaccination does not give 100% protection. So, and sometimes there can be vaccine failure. But after the vaccination, if you get the disease also, that is in the milder form. What if the child has got a chronic hepatitis B infection? The answer is, if the child has a chronic hepatitis B, vaccine is actually given to prevent the disease. It is not therapeutic. So child already has a chronic infection, so there is no benefit giving the vaccine. So don't give vaccine. If you give also, there is no benefit, so it is not given. A baby has jaundice or history of jaundice after birth and has come for BCG vaccination on 20 days of life. What to do? Your answer is yes. You should give BCG vaccine to this child and also give all the scheduled vaccines. This is neonatal jaundice is not a contraindication to any vaccines. Can we give more than one vaccine at a time? The answer is yes, you can give. Multiple vaccines can be given at the same time, included live, inactivated, killed, bacterial or viral vaccines. But you have to remember few rules. So few important rules are administer simultaneously at different sites. So if you give multiple vaccines, you give at different sites. This is one rule. Another is 2 live vaccines is allowed, but give on the same day or at least 4 weeks interval. So if you give before 4 weeks interval or if you give in different days, then there is immune interference and the vaccine will not work. This immune interference means the live vaccines, after entering the body, it should replicate and produce the immunity. So first vaccine replicates, produces the immunity, like cytokine, interference, all these are produced. And when you give the second vaccine, the already activated immune system from the vaccines, first vaccines, will inhibit the replication of the second vaccine. So there is poor antibody formation of the second vaccine. So it should be given at least with the 4 weeks apart. Can vaccine combination be given at a time? Answer is yes, and then what all combination can be given? Live vaccine with killed vaccine, yes, you can give. Killed vaccine with a killed vaccine, yes, you can give. Live vaccine on the same day, yes. But live vaccine and live vaccine on different days, no, you cannot do that. Give on the same day or at least at an interval of 4 weeks, so that there is no interference. Can 2 oral vaccine be given at a time? Answer is yes, oral vaccines can be given at time. Like example, oral polio vaccine, rotavirus, oral typhoid vaccines. These vaccines can be given at the same time because they do not interfere immunologically. Because oral vaccines, they are acting locally in the gut and then they induce mucosal immunity, that is mainly IgA immunity, which is short-lived and then not strong. Systemic immune response is not there. They produce local immunity, no systemic immune response. If they produce systemic immune response also, that is not strong. So one oral vaccine will not suppress or block the immune response of another oral vaccines. So multiple oral vaccines can be given at the same time. When to start vaccination in a premature underweight newborn baby? Answer is as term babies for all vaccines with exception is BCG. So in case of BCG vaccine, given when the weight is more than or equal to 2 kg. And if very premature with a very low birth weight babies, you wait till the baby is clinically stabilized. Child is getting treatment with antibiotics. Can all vaccine be given? Answer is yes, you should give all vaccines. Antibiotic is not a contraindication to any vaccines. Child has chronic disease, how to vaccinate them? So answer, let's see the different chronic diseases. Congenital heart diseases, yes, you should give all the vaccines and sometimes even additional vaccines are recommended. Chronic lung disease, yes, you have to give all vaccines plus additional vaccines. A good example is flu vaccine. Chronic kidney disease, yes, you can give all vaccines. Exception is sometimes the child is a case of nephrotic syndrome getting a high dose of steroid or some other immunosuppressants. So in those conditions, live vaccines are temporarily contraindicated. But after stopping these medications, after 1 month interval, you can give the vaccines. And even in chronic kidney diseases, you recommend additional vaccines, especially nephrotic syndromes, they should get additional vaccines. So vaccine in special situations I'll discuss in separate different class. Then suppose the child has liver disease like hepatitis A, must get all vaccines. But hepatitis B, if it is already chronic, then don't give hepatitis B vaccine. But other vaccines are recommended. Child has allergy and asthma. Can all vaccines be given? Answer is yes. Asthma is not a contraindication to any vaccines. But if the child is unstable, having unstable asthma or uncontrolled, so that time you can delay the vaccine schedule and delay. After the child improves, you can continue with the vaccines. And remember, allergy is not a contraindication to vaccination, except specific proven severe allergies like severe anaphylaxis was noticed during the previous dose of the same vaccine, then it is contraindicated. Otherwise, simple allergy is not a contraindication. Regarding egg allergy, if there is a confirmed anaphylactic reaction to egg, then yellow fever vaccine should not be given. But other egg-grown vaccines contain very negligible egg protein, so they do not trigger the anaphylaxis. So the examples, MMR, rabies, influenza vaccines, though they are egg-grown vaccines, the protein is negligible in amount, so these are not contraindicated. Only yellow fever vaccine is contraindicated. Okay, pregnancy Are there any contraindications to vaccines? Actually, there is no evidence that any live vaccines, including MMR, causes any birth defects. But since theoretically there is possibility of fetal infection, so live vaccines are contraindicated during pregnancy. So during pregnancy, don't give BCG, MMR, varicella, oral polio vaccine, yellow fever, typhoid oral vaccine, or influenza live vaccine, which is given as a nasal spray. But inactivated vaccines, they do not or they cannot replicate. So this can be administered during pregnancy. So the safe vaccines are influenza inactivated, TDAP, TD, typhoid and diphtheria. TDAP is acellular pertussis. AP is acellular pertussis. Hepatitis B can be given, COVID can be given, rabies vaccine, and then IPV, that is injectable polio vaccine can be given. If there is a family history of convulsion and child is a case of febrile seizure, can vaccines be given? Answer is yes. Follow the same schedule as for the other children. But if the child is currently having moderate to severe febrile illness, or if there is uncontrolled seizure, then you wait till the child is stabilized. And also always tell the parents vaccines do not increase the risk of epilepsy, so that they continue the vaccination. Child is on steroid high dose. Which vaccines are safe? The answer is do not give live vaccines. Give at least 1 month after stopping the steroid. Killed vaccines are all safe. And remember, topical and inhaled steroids, which is in minimal doses, those are not contraindication for vaccination. So topical steroid, if you're getting the inhalation of steroid, like in asthma, you give steroid meter dose inhalers, so those children vaccine is not contraindicated. Only in high dose oral dosing of steroid, you have to wait till 1 month of stopping steroid. Active immunization is recommended following exposure to which infections? So these are known as post-exposure prophylaxis. So these are required among the viral infections after rabies, measles, varicella, hepatitis B or hepatitis A. If you come to these diseases, if you get exposed to these diseases, you need to take vaccination. And among the bacterial infections, tetanus, meningococcal disease and diphtheria. Infantile spasm, epilepsy, is the immunization contraindicated? Answer is no. They can receive all the routine vaccines, even the pertussis containing vaccine they can give. Contraindicated if there is a progressive uncontrolled neurological disease of unknown cause, seizure is active or uncontrolled, then temporary deferral is required, and then acellular pertussis is preferred over the whole cell pertussis where available, because acellular pertussis there is less risk of convulsions. Neurocutaneous syndrome like tuberous sclerosis, Sturge-Weber syndrome, can they get vaccines? Answer is yes. It is not contraindicated. Give all vaccines. Which conditions pertussis vaccines is contraindicated? Absolute contraindication for pertussis vaccine is if the child develops encephalopathy, coma, prolonged seizure, decreased consciousness within 7 days of previous pertussis containing vaccine with no other identifiable causes, then further dose should not be given. This is absolute contraindication. And in which conditions pertussis vaccines is deferred? Especially the DTWP, this is a wholesale pertussis. So deferred, it is not absolute contraindication but deferred. Answer is number 1, if there is a progressive or uncontrolled neurological conditions like infantile spasm of unknown etiology, uncontrolled epilepsy, having uncontrolled seizure, or if there is a progressive encephalopathy, then you have to wait till the child is stabilized. And in case of moderate to severe acute illness, with or without fever, you defer until the child is stable. If child has bleeding disorders, what to do? So in this condition, use small needle of 23 or less than 23 Gauge and apply sustained pressure for at least 5 minutes without rubbing in the injection site. Breastfeeding is not contraindication to any vaccines. Okay, some other tips are: mixing vaccines in the same syringe is not recommended unless specifically licensed and recommended for use. Vaccine must be checked to ensure that right product and correct dose is used in appropriate way for each individual. Vaccines must not be used after the expiry date. A minimum interval of 4 weeks is recommended between 2 live vaccines, if not administered simultaneously on the same day. Killed antigens may be administered simultaneously or at any interval between the doses. Immunoglobulins, they interfere with the immune response of certain live viral vaccines because the immunoglobulins may contain antibodies against measles or varicella. So, if immunoglobulin is administered within 14 days of vaccine, then you have to repeat this vaccine schedule after 3 to 6 months because this immunoglobulin neutralizes the vaccine. So, it is not effective. Live virus vaccine should therefore be given at least 4 weeks before or 3 months after injection of the immunoglobulin. Next is, every freeze-dried vaccines has their own diluents. Diluents must not be frozen but should be kept cool at least 24 hours before diluting. And all vaccine administered by auto-disable syringe except for OPV. So AD syringe, it looks like this in the picture, you can see. Next is, all freeze-dried with diluents should be discarded 6 hours after reconstitution or after the session, whichever is coming first. So you should not return this back to the refrigerator, you have to discard. Non-freeze-dried multi-dose vials, they can be potent up to 28 days after opening if all other safety precautions are met. If the cold chain is met properly, they can be potent till 28 days. All vaccines stored at +2 to +8 degrees Celsius. Deferral of immunization. If the child is very acutely unwell, then defer until they have fully recovered. This is actually just to avoid the wrongly attributing any new symptoms or progression of the symptoms to vaccine. So during illness, if you give vaccine, the patient may wrongly or the parents may wrongly interpret that new symptom of the disease with the vaccine. They might say vaccine has caused those symptoms, but actually those symptoms may be of the illness. So to prevent that, when the child is acutely ill, usually we defer the immunization. Now, periods of maintained immunity by vaccines. Some gives lifelong immunity, some gives moderate duration immunity, and some has a very short duration immune response. So, vaccines having lifelong or very long immunity are BCG, gives immunity for 10 to 15 years. Measles, rubella, varicella, yellow fever, it is said lifelong. Mumps, long-lasting, sometimes lifelong. Hepatitis B vaccine, 20 or more than 20 years or maybe lifelong. But this differs from individual to individual. Then moderate duration vaccines actually requires boostering doses just to prolong the efficacy of the vaccine. So examples are DPT, pentavalent, oral polio vaccines or injectable polio vaccines gives a immunity of 5 to 10 years. Hepatitis A, 20 to 30 years, sometimes even lifelong. And short duration vaccines are cholera vaccine, 6 months to 2 years, typhoid vaccine injectable 2 to 3 years. Oral vaccine gives 5 years immunity. Influenza vaccine 1 year, because there is an antigenic drift. So this is given yearly. So short duration vaccines are repeated yearly or 2 yearly, 5 hourly, yearly, that way. Moderate vaccines with boostering doses, they may gain the lifelong immunity. And then the ones with a long immunity requires less doses. Level of effectiveness. Absolutely protective, that is 100% effective vaccine is yellow fever vaccine. Almost absolutely protective, 99%, is variola, that is a smallpox, measles, mumps, rubella, diphtheria, tetanus toxoid. And highly protective, that is 80 to 90%, is polio, BCG, hepatitis B, pertussis vaccine. Moderately protective, 40 to 60%, examples are typhoid vaccines, cholera vaccines, influenza vaccines. The killed influenza vaccine. Now the suitable sites. If you give 2 or more than 2 injections at the same time, then you have to give at separate sites, preferably different limbs. If you give 1 or more than 1 injections but in the same limb, then give at least at distance of 2.5 centimeter apart. Then immunizations is not given in the buttock because there is a risk of sciatic nerve damage, 1. Next is there is possibility of injecting vaccine into the fatty tissue rather than the muscles. So injection in the fatty tissue of buttock, if you give, this reduces the immunogenicity, especially of hepatitis B and rabies vaccine. So hepatitis B and rabies vaccine is never given in the buttocks. Okay, thank you. Hope these tips were useful for you all. Next class I'll continue with the vaccination schedule. Thank you.